Welcome back, everyone. Our guest today is a clinical psychologist. She is also known as the Truth Doctor on social media. She has a large following on many different social media platforms where she shares informative and entertaining content about mental health. She's an addiction and mindfulness expert, and she's the CEO of Good Heart Recovery, which is a community-based adult addiction clinic. She's also the host of a top mental health podcast called Your Unconscious is Showing. We'll plug all of her information in the description below. Please be sure to check out her content, and thank you so much for joining us, Dr. Tracy.
You're welcome. Thank you so much for having me on here today. I'm excited to get started.
Yeah, we really appreciate it. We're definitely excited for this conversation, and think mental health is just such an important topic, especially right now. So yeah, we like to get started just by asking a little bit about your background, kind of how you've gotten into this field, and maybe some of the factors that influenced you in getting into this field.
Definitely. I love talking about my journey because some people want to go into the mental health field or the behavioral health field because initially they're interested in science or they're interested in the mind in general from more of an exploratory standpoint. And for me, I grew up wondering about the mind because I lived in a household full of ailments. And I found myself wondering why people got addicted to substances, why they got angry sporadically and intensely, and how poverty and multi-generational households could contribute to mental health and substance use issues. So as I was growing up, I paid a lot of attention to the minds of my family members, but specifically in a way looking at how they were detrimental to my ability to thrive in life. And so I was basically looking at all the barriers, all the mental health barriers, all the substance use barriers, and all the lack of educational barriers when it comes to how are we supposed to know how our mind works and how our body works if we're never really given proper education to do so. So I was lost for the majority of my teenage years until I took a psychology class in high school. And I was like, okay, so there are people all over the world specifically studying mental health to try to find the answers to the questions that I've grown up with my whole life. And so I loved this psychology class. I ended up going into an AP psychology class, and I did not get good grades in high school, but I aced this AP psych class. And I decided that I was going to go for a bachelor's in psychology. And I was a major partier throughout high school and college. And so I got really deterred for a long time in terms of my psychological studies. And I took a break from college, experienced a lot of loss from my high school group from substance use and the opioid epidemic, came back to finish my bachelor's degree in psychology, and decided that I wanted to emphasize on substance use because I knew the people that had passed away had mental health issues and that they were only using the substances to mask their internal psychological issues. And I was like, if I like psychology, I've already seen substance use in my family, it's now taken away my friends. I'm going to try to support this field and figure out, what the hell is going on with humans' behavior to take something outside of themselves to try to fix either an internal or an external problem. So that's when I decided to get my master's in social work, because I wanted to see, because alcohol, it goes from the government all the way down to the individual. Like any substances, we're trained, our mind is trained to want them or to not want them. It's a very complex, all the way from the macro to the micro. And so I wanted to look at advocacy and policy and the family and the individual. So I got my master's in social work. And then I wanted to go on to get my doctorate in clinical psychology because I really wanted to dedicate my studies to figuring out, okay, so before I got my doctorate, I was working in the mental health field and the substance use field. And I saw everybody kept relapsing. 60 to 80% of people who complete treatment successfully relapse. Why? And so I wanted to go get my doctorate so I could really dive into the studies of why do people relapse? What's going on with the interventions that we're using? They're supposed to be evidence-based. Why are we running into such recidivism? And so I did that. And I just finished my doctorate actually last August, started my social media account, and planned on getting licensed as a clinical psychologist, only to find out that you can't get hours at any center that you own. And so I was like, okay, so then I don't want to choose licensure or the business that I opened. I'm like, but I already have my license for social work. And so I'm still maybe going to do that in the future. But what I wanted to primarily focus on was like, okay, I have a treatment center, I have these degrees, and social media really took off for me, especially throughout the pandemic, with an increase in mental health and an increase in substance use. So my education and all my experience has really like led to this moment where I'm on this podcast with you guys today, combining all of that together and talking about it.
Wow. That is awesome. Because I just know that I've been like consuming some of your content recently, and it has been really helpful. And it's interesting how everything just kind of like took a turn so fast, I feel, with social media. I had no idea that you could not get your hours done
that's fascinating
at your
that
own
they
place.
Yeah,
would do
it's
that.
wild. And so, yeah, I had to decide. I'm like, and social media is a place where you will get judgment. And people will say she doesn't have a license with her doctorate. And it's like, if I could explain that it's because I decided instead to keep my center open that are like curing people for their mental health disorders, then that may ease that. But it's really something like, if there's I'm just going to throw this out there. If I could get they don't even allow external supervisors at the place that you own. And so it's super interesting. I understand it because then you could kind of weave your way through the licensure requirements, but yeah.
I'm fascinated. I'm curious because you were mentioning about your some of the reasons why you wanted to get into getting your doctorate in the first place, and about the relapse rate of people who've gone through successful treatment. I mean, doesn't sound successful if we're getting a high level of relapse, right? What did you find out about why that was maybe happening? Or did you come up across anything kind of interesting when you were digging into that?
Well, yeah. So even though I was really interested in mental health throughout my life, I was very resistant to going deep and looking at, not necessarily spirituality in like the woo-woo sense, but like more so existentialism, like purpose and meaning and authenticity and self-realization. And so when I started working in treatment prior to opening up my own center, I met a few individuals who really took the spiritual route to their own recovery. And I was like, and that was where I was seeing the most change at this place that I worked at, was like these specific people were making the most impact. And I realized that I had only heard of one other center in the country that focused on spirituality as an emphasis to heal substance use disorders. So that's when I left and opened up my own center, and I focused it on mindfulness-based and compassion-based interventions. And when I opened up the center, I started my doctorate. And so it was an entire 3-year journey of figuring out how can mindfulness-based interventions and compassion-based interventions come into the field of substance use, and will it affect the relapse and the recidivism rate? What I found was that cognitive behavioral therapy is used most predominantly for substance use disorders. And they, even if we look at like meta reviews or systematic reviews, in general, it will say that it's beneficial for substance use disorders, CBT, DBT, motivational interviewing, contingency management, behavioral modification. But those are all the interventions that have already been used that are still contributing to the relapse rate. And so my dissertation, there aren't very many studies. People aren't really like willing to go and take a look at self-actualization with someone that has an opiate use disorder, because they think that the risk is high. And what they don't realize is that the risk is already high. Everyone is already dying and everyone is already relapsing. And so we need to take a look at something different. And so I was able to compile, a bunch of resources, primarily on CBT, because that's like the most used in the field. And it's not effective for many specific use disorders. In general, is it beneficial? Of course it is. People can be successful with CBT treatment or DBT treatment. What happens after they leave? What's missing? And what I did was I looked at the studies of, small sample sizes, of course, because no one's going to fund something huge that's not already evidence-based. even though that's how you get things to be evidence-based. But it was really impactful. Each of these people that had a substance use disorder were able to find meaning and purpose. They were able to create an internal life that they didn't want to lose. Instead of learning about thoughts and feelings and then making a resume and getting a job and hoping that that's going to help them thrive, they actually had essentially an existential break to figure out who the hell they really were, why they were doing what they were doing, and how they can find purpose and meaning that will give them the actual foundation to succeed versus just the walls that will hold up any issues that they're having. It's the foundation of who we are as a human being and why we want to numb ourselves. And so that's what I wrote it on. And I said, listen, insurance companies may not be wanting to pay for mindfulness-based or compassion-based interventions, but all that means is that they're just paying for more CBT treatment that isn't working. And their patient or their client is actually coming back around way more often than they would like, because they're not open to, supporting these other modalities that can be proven to be evidence-based and supportive if people were willing to take the jump and do so.
Man, yeah, that is so frustrating. I think about like medication and how like some clients, like medication works long-term, but medication is typically just used for some symptom relief, right? Similar to CBT, I know it can be long-term in some cases, but it's symptom relief. And if you're not really digging at what's underneath, that problem will resurface. So I really appreciate your like approach that really hones in on like trauma and lack of connection and lack of purpose. Cause yeah, as I've been learning and growing in this field as well, it's so evident that substance use isn't just this physiological addiction. It's lack of connection and people not having meaning in their life. And when they do, like you see these things go away because they don't need to go to some altered state of consciousness anymore.
Right.
They're ready to be in what they're in.
Exactly.
Yeah. Wow.
Yeah. And I think, so I guess just to give you some quick background on Nick and I too. Nick is in a program to get his doctorate in clinical psychology now. I am not in the psychology field. So if Nick starts dropping some knowledge, I mean, I know what like CBT is and like Nick's helping educate me, but so I may say some stuff that seems pretty obvious, but I'm processing a lot of this at the same time. But I like coming from like the more business and HR side of things, there's a little psychology going on in there. And a lot of the stuff that we hear about, especially when they start to survey like millennials entering the workforce, is like, what do these new employees, what's most valuable to them? How can we create a culture that's inclusive? All of these other things. It's everything you're talking about. It's wanting to understand themselves, wanting to have purpose, wanting to feel included in a community and all of these things. And I think that's what I like about your stuff, all your social media, your podcast so much, is that you're helping people get there. And it's not necessarily on these companies to do that. I think they should be supporting that without a doubt. But, talking about things, I wrote some notes here, just like things like people going on autopilot because there's just like these processes that they've like been ingrained with throughout their life. That they just like, they don't think about them, but certain things happen. And then it's like that trigger and they get pulled into these like responses that they can't even explain until they kind of become more self-aware in that way. I think it's so important. And I think I think this type of stuff is going to long-term do the most good work out there that like needs to be done, because people need to understand this stuff and they need to understand like getting those tools to help themselves in that sense. Yeah. So I've really been enjoying your stuff.
Well, thank you. And yeah, I think that you're completely right. When you like autopilot, it's like we are all on autopilot. The government is on autopilot. This entire fucking planet is on autopilot.
We're explicit. So
okay.
Yeah.
Our whole existence is on autopilot unless we make the decision for it not to be.
Mm-hmm.
And that's like really where it comes in. And people don't even realize, like even therapists are on autopilot, treating clients that are on autopilot. The intervention is autopilot. And it's like, and then the client is an actual human being with an ever-changing thought process and an ever-changing body. And what's the one thing that can sustain all of that? It's the fact that we're alive and we really want to have a reason for that. Like, that's the point of like existence, is to find the purpose and meaning for it, so that you don't want to die, so that you don't want to kill yourself, so that you don't want to drown yourself out and absorb the symptoms that you're experiencing for the entirety of your life. And so we have to learn this. It's like so important. And yeah, I mean,
Well,
if we knew it, we wouldn't need therapists.
yeah. And even just for myself, you know, I would consider myself extremely fortunate to have not gone through anything that I would even remotely consider trauma or anything of that nature in my youth. But as you in the unconscious podcast that you did, I think it was like your 6th episode, you were talking about how that puts me on autopilot to not be supportive in the proper way. And I think as I've gotten older, I've realized that while maybe I haven't been in the position where I need to figure these things out because I may need the help understanding myself, but as a resource and a community member and a person in other people's lives, I am on autopilot in the sense that I don't know how to properly respond to the people who need me there. And that's been honestly like the most unbelievable thing for me in listening to your content, is that I need to shake my own autopilot so that I can put myself in the right frame of mind to help somebody get out of their autopilot. And like, it's been quite the, like, even just, I mean, the last 3 hours of like kind of thinking through like this interview and like talking to you, I think that's been like the one thing that like is still on my mind. I don't know, Nick, were you about to say something? I think I jumped in right before you. Go ahead.
It's along the same exact lines of when I was listening to that podcast as well, talking about the subconscious. Like most people who have gone through high school maybe have an intro psych class that they're offered, and they're taught about Freud and maybe the iceberg theory of the unconscious and the subconscious and the conscious. So most people have like a general knowing of what it is, but I don't think it's really talked about in the context that you, or in the depth that you talked about it in. And I think it was really helpful to hear about it. So it would be awesome if you could explain a bit more about how our subconscious does affect us every day while we don't know.
Yeah, well, it's a very massive topic for sure. I mean, well, it depends on like what you believe about being born. You know, are you born as a blank slate? Are you born with the ability to go so far with a certain personality or a certain physical ability? But in general, we're constantly absorbing how our body is reacting, the thoughts and emotions of the people around us before we can even call them thoughts or emotions, and everything that's going on in our external environment. And so what happens when we're going on autopilot, because we are absorbing so much information, sensory information, internal information, all at the same time. And our brain needs to not focus on all of that at the same time. And so what our brain does is it has the capacity to memorize certain aspects of your internal and your external environment. That's how we go on autopilot. It's that we don't have to consciously be aware of tying our shoes, walking left foot, right foot, eating food, swallowing food. Like we forget that we were taught how to do all of those things. Besides, you know, the reason why I called my podcast Your Unconscious is Showing instead of like Your Subconscious is Showing is because we have subconscious thoughts and emotions, but we also have unconscious body mechanisms where if we're like knocked out, we're still breathing, our heart is still racing, or our heart is still beating, like we're still alive. And so those are unconscious. Our immune system is functioning. And then we have our subconscious. And what happens is that our brain will take certain aspects of things that we know maybe are going to happen on a regular basis, and we'll memorize them so that we don't have to have them in our conscious awareness, so we can learn new things or look out for danger. And so what happens over time with autopilot, let's say with someone that experiences trauma, is their body and their mind is going to get used to being out and looking out with a radar for something that's traumatic. And so that's like part of like anxiety disorders, panic disorders, trauma disorders, is like will become triggered by our internal and external environment, because subconsciously and unconsciously it's connected to these memories or these sensations of trauma. And if we are happy-go-lucky and we haven't had any trauma that we've experienced in our lives, then subconsciously, like, we think it's all good. And we can't really relate to someone that's having a panic attack because you're like, I don't understand. Everything seems fine. And it's with the education to be like, oh, okay, this person's having a panic attack. This is probably what's happening in their body. This is a few reasons why they may be having that panic attack. And here's how their subconscious or unconscious may be interacting right now, because I know consciously that everything is fine, but this person's subconscious or unconscious is activated and their conscious is turned off. Because if they were conscious, then they would be where I am and be like, oh, there's nothing going on. And so that's like an example of how someone that's conscious and doesn't have trauma in their subconscious could be disconnected and misunderstand someone that's not conscious and has trauma in their subconscious. And so our brain wants to protect us, wants to keep us safe. And that's why we're going to look out for things that make us scared. We're going to look out for things that could help, that could end our lives, because we're surviving beings and we don't want that to happen. And so it's, what does your subconscious look like? What did your parents teach you? What did your culture teach you? What did your trauma teach you? What did your lack of trauma teach you? And then, are you your subconscious? Or, and okay, so I'm called the truth doctor. I believe that truth is unadulterated reality. It's all the shit that hasn't been affected, which is not much from the moment that we're born. But you have this true core to who you really are. And it's taking a look at your subconscious and seeing, what do I really believe? What am I conditioned to believe? And then what do I want to do about it? And so that's kind of what my whole platform is like, you're not who you think you are, you're not what you think you are, and the world around you and all the people around you are also not who you think they are or what you think is going on. And so it's like dismantling almost the entire cognitive map that we've created through our whole existence.
Yeah, it's like everything's a construct, right?
Yeah.
That's been created.
Yeah. How can somebody go about figuring out what some of their maybe more negative unconscious traits are? Like, if I was sitting here being like, man, what am I doing unconsciously that I need to like work on or improve on or whatever that is? How can I go about starting to figure that out?
That's a really good question. And no one's actually asked me that question before. So I think you can take any thought, and this is, kind of CBT, any thought, any feeling, or any behavior, and trace it. Trace it back as far as you can remember. And so, like, for me, even being however far along we are into this podcast episode, my body internally is still shaking. I'm like not nervous, but my body is. And so I have to think, why am I internally shaking? And then I have to think, okay, so I'm nervous in a potentially or partially public situation. Has there been another experience where I've been nervous publicly? And if so, when was that? And was there one before that and one before that? And if there aren't any of those, then have I ever been put on the spot by a family member or put on the spot by someone random in public? And how did that go? And if it didn't go well, what was my response? And is that response similar to this response? And if so, then I'm consciously present answering, but my body is subconsciously in that experience. And I have to figure out what are those experiences, or what are those things that people told you? Or what's that thing you saw on that TV show when you were 10 years old, when you compared your body to that other person, and now you're 30 years old and you still don't like that body part? It's like, we have to go back and figure out the origin, because we weren't born with literally any of our behaviors outside of survival behaviors or our thoughts or our emotions.
It sounds like this could even be like positive or negative, right? Like, we can trace back our positive reactions to certain situations, be like, oh yeah, like I saw my mom do that. Like, that was a good example. She did that all the time, so I just picked up on it. And same thing, negatives, like overreaction in an argument or something like that. It'd be like, well, wow, that was modeled for me that way. So like, that's how I picked up on that. Okay.
Yeah.
So just self-reflection after a situation that either you felt good about handling or poor about handling. And then just tracing back, trying to identify where that came from. Okay, cool. cool.
Yeah, I mean, definitely. And that's like honestly a lot of the work that happens in therapy, because we aren't taught how to be self-aware, how to self-reflect most of the time. And it's good to have someone, I believe in education. Knowledge is power. I think wisdom is knowledge mixed with emotion. And if we can become wise by getting the education and figuring out our own emotions, then we can actually move forward in our lives. And it's like, we have to what we're usually doing is we're on autopilot, and we're so full in our lives. Even if we don't have a job and we don't have a family and we're depressed, our life is just as full as someone that isn't depressed and has a job and has a family and is doing great. We're so impacted by just all of the stuff, positive or negative. And what we do is we're so overwhelmed as a society more than we think, that we don't take breaks. Like the fact that employers have to mandate 15-minute breaks or 30-minute breaks is ridiculous. The fact that the government had to put that mandate and then the employers have to make sure that the employees do it. It's like, because we have to have this structure to make sure that like we breathe. And then, sometimes it's like just so workers' comp issues don't come into play, but it's important. It's like we're literally trying to structure breaks in our lives to take a moment for reflection, but instead what we do is we fill those breaks with social media or with emotions or with drugs and alcohol, and we never take the moment to create space between ourselves and our impulses, behaviors, thoughts, and feelings. And that's where the work is done. So yeah, it's reflection. It seems simple, and it really is. It's just we've gone so far away from simplicity.
Yeah, it's really unfortunate that that's kind of how our culture is. Do you think that our culture is moving more towards trying to find that space and create that space for ourselves to be more mindful of these experiences and who we are?
I do. I really do. I think that Eastern philosophy is significantly coming over to more Western medicine. And that's not even looking at alternative versus contemporary medicine and treatment. It's a mindset. I think social media has really allowed people to, it can be used negatively and it can be addictive, but it can also be used to spread messages that people would have never otherwise heard. And it's allowing us to communicate and gain knowledge that we may not have in the past. And so I think, we're dismantling everything, for the most part. Like, we're taking a look at it all. Like, when I'm on TikTok, I started it because someone was like, your personality fits perfectly on there, just do it. And I downloaded it and I was like, okay, I'm in. And the reason why I was in was because I saw human beings from all over the world talking about their mental health issues and also talking about what the fuck wasn't working for them anymore. What wasn't working for them in their family system, in their government, at their job, everything. And we're dismantling social constructs. Like, I see these like Gen Zers like having like these explosive existential moments where they're like, gender is a social construct. Gender is a social construct. And they're like breaking it down and they're like, wait, the only like pink was originally a color for boys and so was high heels, like originally. And now we've decided that it's just for the gender for women. And it's like, so we're looking at what we have just ingrained in our subconscious as fact and as reality. And we're saying, wait a minute, how does the mind actually work? What have I absorbed? And how can I actually be happy? Because I'm not fucking happy right now. And a lot of people aren't, and they're trying to figure out why. And part of that is breaking down how they've been living their lives and who told them to live them that way, and how they can use their mind and education about their mind to make different choices in the future and actually be happy.
Yeah, it's a weird balance with like the rise of technology and social media and really getting fixed on it at times. And then also knowing that it's spreading a lot of positive information and information that people just had no access to before. And so there might have been like the Bay Area that was hot on mindfulness like 20 years ago and nobody else knew about it. So I'm glad that message can start to get spread a little more. But yeah, it does seem like there's like a give and a take, and there's always just this general homeostasis that like things end up like falling in, which is so interesting. Um, but I know that you touched on Maslow's hierarchy of needs as well. And I think that's, again, something that I've learned, but I didn't think about it in the context that you were putting it in. Whenever I learned about it, it was something that I thought about in the context of me right now. Like, do I have all my needs? Am I safe? Do I have food? Do I have some purpose? And I never reflected back to, did I have those things when I was younger, and is that impacting how I'm feeling these things now? So how did you kind of really make those connections, and how do you talk about that with clients or people in general?
Thank you for bringing that up. I strangely became so obsessed with that hierarchy the moment that I learned about it. Like, I was 16 years old and I was like, this is why I'm so fucked up. Like, the bottom is physiological needs: shelter, sex, food, water, sleep. And I was like, this is all messed up for me. Like, my upbringing was terrible. Sorry, mom. And like, so I wasn't capable of building places where I belonged and loving relationships and a stable job and a stable income. And for a long time, until I realized that that was the problem. And so, I mean, I just like fell in love with it immediately. Like, some people they hear something and that's what they roll with. And so I just took that hierarchy and automatically applied it to the one thing that helped me in my life, which was reparenting. And all I'm doing when I'm reparenting is looking at who I was or who I became as a result of my environment, internally and externally, over the course of my life, looking at it in each of those ways, and then figuring out how, like, and they're intermixed. Like, if you're having an issue with the third level, which is love and belonging, then that can impact your lower levels as well. It's not just a bottom-up process. And so I put it in the context of reparenting, and anyone can reparent themselves. Even someone that has, and I get this question asked a lot with people I'm working with, I don't have a problem with my childhood. My parents raised me great. Okay, well, what about the cultural parent? What about the societal parent? What about the governmental parent? What about the global parent? You know, parent is just someone that's supposed to take care of you, supposed to teach you, supposed to mirror you and give you space to be yourself. And so reparenting, even in the racial context, is like taking a look at what you were not provided from your government or your society in the meso and the macro levels of your life, and micro if you need to look at your own family. It's like these systems and these individuals that were supposed to help us thrive, and either consciously or unconsciously, overtly or covertly, intentionally or unintentionally, didn't do that. And it's figuring out why they didn't do that, what parts weren't working for you, and then what you want to do about it. So I just got attached to it, and I realized that what caused me to heal was going level by level and figuring that out, applying it in the context of my own creation, everyone and everything that has ever created me. And then, who am I really? And so that's what I do with everyone that sits in front of me, is we break it down. We break it down level by level. And we start with the ones, especially because I'm working with people that put something in their body that could have make them lose their lives in a physiological way. We start at the bottom. I don't always start at the bottom. But the goal is, and this is something I talked about in my dissertation too, is like most interventions stop at the fourth level. Okay, so we have physiological, we have safety and security, love and belonging, and then esteem for ourselves and esteem coming from others. A lot of it stops and doesn't go to self-actualization and self-realization. And the thing is, we need it, at least in this theoretical context, we need it. And so that's kind of why I focused on that in my dissertation, is like, hello, we're dealing with human beings, and 60 to 80% of them are taking a substance that could literally kill them. Why? Because we're not taking a look existentially at the top of that pyramid. And it helps people, you know, I think in general, also the fact that it's broken up into categories of 5, and there's a lot more categories within each of them, but it helps create a map for the client. it helps them understand that there are all of these elements of life that they need to take a look at and figure out, where is it lacking, where is it excessive, and how can they find their own homeostasis and balance for what they want outside of whatever anyone else has ever told them that they're supposed to want.
Yeah, there's a really important piece of that, like guide when people are feeling lost.
Yeah.
And I really appreciated your explanation on reparenting as well, that you touched on, in that like reparenting, like if you had a good childhood, you don't have to say that you're like bashing your parents and you're just like changing things. It can just be just like a positive adaptation that you've had to go through. I think one of the examples that you gave on your podcast was healthy eating. And that's something that didn't really get preached too much. Like of course I ate good when I was younger, but healthy eating was not something that was emphasized. And I more so had to learn it myself. And I'm grateful for social media on that point, to be honest. But like, that's something that I kind of reparented a little bit, and it wasn't something that was really traumatic. But it was still something. And yeah, I just appreciated that it doesn't have to be like, you don't have to be angry and have that anger there in order to do this. Cause that, I know that that can be a factor that can kind of inhibit this process as well. So yeah, thank you for that.
Yeah, definitely. And I think that you're right. You know, obviously when we're processing our lives, our emotions are going to come out. And if you process appropriately, then those emotions should lessen. So if you're not angry, wonderful. And if you are, once you're not, you've made progress. Once it's not, you know, not denial or not pushing it down in any way, then if the emotion lessens, then you're making progress. And of course it may get worse at first, but then the goal is, like, I'm not mad at my parents because I've traced their behaviors. I know that they have a truth within them. I know that they would have made better choices and different choices if they could. And that allows me to not hold on to the resentment. And that's part of reparenting also, is you don't only ask what you didn't get, you ask why you didn't get it. And so you can actually connect more with the people that you think have hurt you so badly. And of course there's intentional pain, but most of the time, and I bag on parents a lot on my social media. People think I'm like so against them, but like, I love my parents, and most people would be like, they were terrible parents. And I just don't feel that way. And I'm a parent and I get it. I mean, I'm only a parent to a 2-year-old, but I get it. I totally get it. And so, yeah, it's like, it's the tracing so that you release your own blame, and so that you stop blaming other people, and you realize that we're all in this web of emotion that's confusing and bodies that we don't understand. We're all just trying to figure it out.
Yeah. And I think, like, to use your own words to further validate your point, is a parent doing something that maybe didn't feel like it was the right thing in the moment could very well have been an autopiloted response to a situation that they were in when they were a kid, and they haven't worked through that yet. So yeah, like finding that, tracing that back and identifying, you know, what happened, and then maybe saying like, dang, maybe I feel like maybe we can bond over this, or like we both shared this, or like maybe I need to show more empathy towards the situation that they were in, or something like, yeah, I think that's a really powerful like tracing process to like really give yourself the understanding that you may be looking for. Because, and I think you preach this a lot in your content too, is like understanding why you're doing what you're doing is it's almost like that whole like acceptance thing in or like admitting you have a problem in AA or whatever it may be. I think that's such a huge piece of, I mean, for me, whenever I've gone through anything, just like understanding like, wait, why did I do that, is like half of the battle. Because once I understand it, I'm like, dang, okay, like next time I'm going to notice that.
Mm-hmm.
And then I can, you know, take the next steps. I was also thinking in there about the whole idea of reparenting. How much from your perspective do you think that the Maslow hierarchy of needs can be used as like a pre-parenting type of a structure? Because I think that, you know, if we're thinking about all of these things as things that we need to like go back and like find for ourselves, I feel like it would also be the ideal framework for a parent who's like about to get into this.
Yes. And I love that you said that, because as parents, we get so overwhelmed. Like, it's just so overwhelming trying to figure out how to raise a human being when honestly, we're always still raising ourselves. Like, I thought I was prepared and I know a shit ton about a shit ton. And there are days when I'm like, what the fuck is going on? I'm like, I don't know what to do in this moment. And it's normalizing that. So that's why I brought that up. It's like, people can know everything, and human beings are enormous variables. Each one of us has enormous variables. And so I think it'd be great to put it into context and like realize, like, along with maybe psychosocial development, is like, what's going on throughout these different stages. And that's actually, if you think about it, this hierarchy, it's kind of how our life works, or an ideal way of how our life would work. You know, initially we're just focused on eating, sleeping, and drinking and bonding. And then the next level up is like, we're waiting for our parents to make sure that we have a roof over our head and that they make enough money so that we can have the resources that we need for the bottom level. And then it's love and belonging. Are you nurtured? You know, are you? And then it's esteem. It's like we get peer groups and we get jobs and we want recognition for our achievement. But then it's that final piece that's missing. And so it's like, if parents were to focus on that, I think we'd have way more enlightened beings. You know, I named my son Bodhi, which means enlightenment and awakening. And I'm like, let's pray this helps. But like, and it probably will.
Start 'em young.
Yeah.
Right. But it's like, because for me, like in my life and in my husband's life, it was that top piece of the pyramid that was missing. And I wanted to consciously, because I have a subconscious and an unconscious part of me, I wanted to always consciously remember that that is the key to living the life that you want to live. Is I want to help him find self-actualization, and I want to help him find the real him and not miss that while I'm trying to be the parent that provides him these other 4 aspects as well.
I was just thinking to myself in that moment too, like when I was listening to you talking about the reparenting idea, I was like, dang, I am putting this on my wall when I have a child. Like,
Yeah.
I'm like, I'm going to make sure like this is going to be a to-do list every day, you know? So yeah, I really like that whole reparenting idea, because I think it's just such a great framework for so many other, just like, I mean, I think as communities of people, like we're like social animals, like we're meant to be. So I think to go one step even beyond parenting, and you even said this, like the cultural, societal structures that we live in, I think it even helps people be more conscious of like, how am I serving those needs of others in the communities that I operate in? So I think it's just like a hugely beneficial. And I think, you know, I didn't even get it until college when I took a sports psychology class. And in that, it was like, wasn't really contextually there. So I feel like it could be implemented, and a lot of people would benefit from it from such an earlier age.
Yeah, absolutely.
Yeah, and it's an ongoing process in that, like, say you lose your parents or you're graduating from college and you're at love and belonging because your parents have provided all these things for you. Now you're back at the bottom trying to figure things out. Some traumatic experience happens. You have to start from that first step. And it's interesting to think about how different experiences can really impact what stage we're on. And I do think it's just so helpful to like be mindful of what stage we're at in order to like take the necessary steps to progress a bit. So I think it's definitely something I'll start thinking about more often, and even utilizing more so in my clinical work as well.
Yeah. It's so important.
Yeah. Something I think that comes up a lot in a lot of these different topics we're talking about too is like the negative self-talk that comes along with, you know, not feel like being on autopilot, and maybe even the negative self-talk can be an autopilot.
Mm-hmm.
You know, you could just autopilot into that. So how do you like, where do you sit on the whole negative self-talk thing? Like, and how could maybe people like address getting themselves to like break once they realize that they're in a cycle of negative self-talk, like breaking it so that they can transition into some, maybe, I don't know if it's positive self-talk, but yeah, where do you sit on that?
I mean, I think that, you know, we are the center of our own reality. And so it's a lot easier for us to blame ourselves and shun ourselves and think that we're the reason why our life is the way that it is. And even, not addressing self-awareness, knowing that that's going to be an aspect of it. But I think it's simply, I think it goes back to that tracing. It's like, if we're talking negatively about ourselves, why? Like, I know some people, they want to, and I guess that's part of challenging the beliefs, but I think that there's a difference. Like in CBT, it's like, we'll take the negative sentence and then we'll try to find three other sentences that invalidate that negative sentence. And it's like, okay, but that's still really surface level,
Yeah.
and we're never really going to, like, the mind will always be able to engage in self-talk. We're not eliminating that person's ability to do that. And so if we stay surface level, then we're not really addressing what the underlying problem can be. And so it's really like, I'm not smart. And it's like, okay, so what is smart? What's the concept of smart? Who did you learn that from? Are there any other ways to think about what smart is? Has anyone ever called you stupid? Who was that? Why would they say that? Were they called that? What was their perception of what smart is? And it's like, I mean, I have a hard time even working with people one-on-one, because I'm like, let's just live together for a whole week and we'll just break everything down. Like, I don't want to just talk to you for an hour, because I want to actually solve your problems. And so that's why I created these platforms, because it's like, I'm just going to be here all the time, every day, constantly throwing shit out for free to try to make a difference. And so, yeah, when it comes to self-talk, or negative self-talk, you have to go deeper, because unless you like do brain surgery or like, go into some type of hypnosis that like eliminates the ability for you to have negative self-talk, you can't cancel it out. And so you have to figure out, first learn about the process of it. Why are you doing it? And then take each negative perception and root it all the way back. Because like, females that have like body image issues, for example, culture and families have been deciding what is a good female body and what's not a good female body way before whoever this woman is that's having negative self-talk about her body existed. But everything that has happened before she came to be is impacting the fact that, like, is causing her to give herself negative self-talk. And if we don't at least emphasize that that's a fact, and we stay in the now and like exactly what's going on for her with that one specific thought, we're not actually addressing the cause of what's going on.
Yeah. Processing trauma is difficult stuff, but yeah, digging deep. Throughout our conversation, this is just something that I've been learning as I've been studying clinical psych more and more. It's just that grief is so present in everything. Like, grief is not just in the context of losing a loved one. In the context of trauma, we go through a loss of something that we never had, maybe, or something that was a really severe experience. We're angry about it, we're in denial about it, and then hopefully we can get to this piece of acceptance, and that's like what healing is. It's so interesting to see how grief plays such a role in our life, and I feel like that just doesn't really get talked about. And I think it's something that you preach a lot, and as we go through these stages of loss and these stages of acceptance and finding meaning and purpose. So yeah, it's been helpful to like just bring everything around in my head in that context. I did want to ask though, as I've studied clinical psych, there have been like main key takeaways that I just like love, that I think are like so true. And with all the information that you've gathered and that you preach, like, is there one piece from it all that you're like, wow, yeah, that's what I want people to hear?
That's a great question. Well, one thing that came up for me when you were talking about grief is if you like, we are all actually in grief, even if we don't know it. Like, we should grieve the fact that our lives are not as good as they could be. Even if you think that your life is good, it could be better. And I think, and what I mean by that is like, so like sometimes like I lay in bed and I have a really hard time. Like, it makes me emotional to even think about it, because I think in this moment, mothers are losing their children, people are being murdered, people are passing away, like all of this stuff is going on. Like, someone's getting their heart broken for the first time, a baby's crying because their toy got stepped on. Like, there's so much pain in the world. And it's like, when we try to do these surface level solutions, we're forgetting about like, we really are living in a very grieving existence. And it's like coming to terms with that. And then like, you have to accept that, so that you can find happiness and joy. Because if we didn't have grief, then we wouldn't really know like what love and acceptance felt like. And so I just wanted to like bring that up, is that we are all grieving, and knowledge is understanding what that means. And so to answer the question that you asked of, you know, one takeaway, one thing that's really impacted me that I try to share with people, I think it's just like, you're so much more than any thought or any emotion or any behavior or any situation you will ever have. Like, you're actually none of that. We just absorb it all to create an identity so that we can thrive in this world, but we're not any of that. We deal with all of it, but we're not any of it. And that's kind of what it was for me. It was like that's why I'm able to be on this podcast with you today, when I used and tell my truth as the truth doctor, when all I used to do was compulsively lie about who I was and hide everything I possibly could about myself. Because I'm not my thoughts, and I'm not my emotions, and I'm not my behaviors, and I'm not what other people told me. And I'm not a female or a woman in the way that like we've used the development of language to describe that I am those things. Like, everything actually has no label. Everything's constantly changing. Nothing's ever touching. And we've just created these concepts in our minds. And maybe that sounds like I'm like tripping on drugs, but consciousness kind of is that. And so I think that that's the takeaway, is like, we're living in this crazy reality that we've all made up, and we're going to be okay, because we're actually none of that and all of that at the same time.
I love that.
Yeah, me too. And I think that resonates with me a lot, because one of the things that I know that you do a lot through your social media too is like, you know, you kind of role play those scenarios, like your TikTok style videos of like parent psychologists, like talking to one another. And it like does such a great job to validate the issues that a lot of kids have. And it's like, because I think a lot of people, if they're stuck in the system of like, for example, if that was somebody's parent, then they're going to make the kid think that they're the person that's wrong in the situation. And I think what you do such a good job of is encouraging that people are finding this like empowerment in themselves to like not only be more than you think you are possible of being, but like you're also in control of proving that you're more than you're capable of being. And I think that that's so cool, because like in a world like we were talking about, where like all of these social anxieties and all of that stuff is so on the rise, I think people need that like more than ever. So
Definitely.
mission accomplished on what your favorite thing is, to answer the next question.
Thank you.
Do you have like go-to mindfulness techniques that maybe you utilize or you utilize with clients the most?
You know, whenever someone asks that, I have to say, like, so I believe in meditation and I'm not good at it. And I believe in mindfulness, and I have a severe anxiety disorder. And so it's really difficult for me to actually engage in mindfulness. And so people who, I don't want to like group them together, but most people that use substances, they've had a very unique lifestyle. And unless they go like full on Buddhist monk and they're like, you know, forever engaging in mindfulness for the rest of their lives, which I've even seen people who have taken that route and they're just like not actually doing very well. They just think they are. It's like mindfulness is like, it's a state of mind. It's not a practice. It is a state of mind. And so every single moment of my life, maybe to my detriment sometimes, I'm mindful. And so I think that it's like, and that's taking control back of your mind. And so I think all mindfulness techniques are helpful. I think like the 5, 4, 3, 2, 1 grounding technique is helpful just to learn about how you can like use your senses in the moment. But then I always like to take it a step farther and realize you do realize that you're always seeing things, and you're always hearing things, and you're always tasting things and touching things, sort of, not really at the atomical level, but we are always using our mind. And so for me, it's a constant state of practice. And I think that's what gives people control over their emotions, over their situations, over their impulses, is that your mind is a machine, your mind is an organ, and you have to realize it's constantly functioning. And if you realize it's constantly functioning, even when it's driving you batshit crazy, that's you being mindful, because you're just realizing that your mind is ever present, you know?
Yeah, no, I completely agree. Because whenever I do engage in some type of mindfulness practice to where it's like a really dedicated space and time, I'll always think in my head about why the hell don't I do this all the time? Like, why aren't I just mindful 24/7? And I would feel this zen and this calmness. So yeah, I do think perceiving it more so as like a lifestyle rather than just an exercise, I think is really beneficial.
Definitely. And I think it's also important to note is like, you can be consciously aware of your mind and you can be having a really fucked up day. And you can be like, I'm mindful all the time. Like sometimes my physical anxiety will become me yelling. Like sometimes I yell, and like a lot of us do, but sometimes it's hard for people to say that, but I do. And it's like, I yell at my husband for no reason. And the thing is I'm mindful that like this is happening in my body and it's probably going to happen. And then I'm like completely observant of it happening. And I'm like, what the fuck? Stop it. But like, I can't stop it. And then I'm mindful right after. And I'm like, okay, that just happened, but I'm still really pissed. And then I'm mindful of myself calming down. And then I'm mindful of going and being like, I was me again. Sorry. You know, like I'll work on it. And it's like mindfulness is non-judgmental awareness of the fact that you are alive. And so I think that's important for people to know is like being mindful doesn't mean that you're going to be perfect. And it doesn't mean that you're always going to make progress and be moving forward. Being mindful is accepting who you are so that then you can work on the parts of you that you would like to get rid of.
Man, something you said too just triggered a question that I had. And when we talk about doing things like going on autopilot, and like, let's say we have a habit of being in autopilot and we do something that we don't like about ourselves, like a conditioned response that want to fix. I'm kind of blending a whole bunch of stuff we've talked about here. So let's say I'm just going to give you a scenario and then I'll ask my question at the end. Let's say I'm in a position where I'm a parent and my child does something that I don't like. And my triggered response is like to yell, tell them that what they did wrong, and like put them in timeout. And like, maybe that was the right response, maybe not. But let's say I feel bad about my response in that moment. How can one deal with in a way that is in line with wanting to be better? How can one deal with like the manifestation of those negative autopilots? Like, do you think like quickly jumping to apology and like being vulnerable and talking through what happened in the moment? Like, how can somebody like take that and use it as like a good learning moment and not let it like fester and be another negative?
That's a good question. We have to be open. So if we have absolutely no idea why we just did that, then going and apologizing for it, it may not get the best reaction if the person that you're apologizing to like knows that you don't really know why you did that, and that may not be the best solution. Like I remember when
this is bullshit. Why are you saying this?
Exactly. Like I used to apologize to my husband and he'd be like, and now he's like, I get it. I know, because I've grown a lot we've been together for 15 years. And so I've grown a lot.
Me and my wife are at 10. So I'm right there with you.
Yeah.
Put me in the years. Yeah. Congrats to you too.
So, I think, well, it's having some type of experience with the tracing so that you don't immediately go, this is me, I'm bad. And then so that you also don't immediately go, sorry, I won't do it again. It's like, it has to have depth. And so even if the person's like, I want you to apologize right now, and parents do that a lot with children, like say you're sorry, but they don't know what that means. It's like, don't say sorry unless you mean it, or say sorry for the behavior, but don't say that you won't do it again. I still don't say I won't do it again. I'm like, I'll work on it, and that makes him so mad. He's like, but I don't like it. I'm like, well, I don't have to tell you. I can say I'll never do it again, but then I'm lying.
Yeah.
And I don't lie anymore. And so I think it's just making sure that you at least are open to going deep if you haven't already gone deep, and not apologizing and saying you won't do it again if you're not sure that you won't. I think that that's really important. And I also want to say that I wish that there was training to be a parent before people became parents.
Yes.
I really do. And, and that's why I, give so much free mental health education, because people would just make a lot of different choices if they understood how their mind and their body worked. Now, for me, it's like having this conscious awareness. I may like lash out at my husband, who really does not deserve it, but I will never do that to my child. And me and my husband have been through shit. So my mind's like, you can be mean to him because that one time that he did that thing, even though that's not accurate, but that's like my old self. But like, I just won't do that to my child. I just won't do it. I'm not going to do it. Like, unless I have a psychotic break and I'm no longer conscious, I'm not going to do that. And so I think that that's really important, is like, you will make better choices if you have better information. And that's how you can forgive your parents when you're reparenting. And that's how you can not blame yourself. And that's how you can be a better parent. And that's how you can improve aspects of your life that you want to improve.
Cool. I like that answer.
Thanks.
Yeah. So we talked a little bit about you sharing all this information on social media, but you also have a course. Is that correct?
Yeah, I have 4 courses right now that are free online: childhood trauma, what is anxiety really, how do you forgive yourself or someone else, and then just how the mind works in general. And those are all available for free. Now, I did just get picked up, this is like my first time talking about this, but I just get picked up by a network for a TV show. And
wow, congratulations.
Thanks. And a revamping on the podcast and a bunch of new courses. So there's a lot of stuff coming out, and it's all in the premise of the unconscious, reparenting, and the hierarchy of needs. So this podcast is very timely.
Wow. That is awesome. Yeah. Congrats. That's so exciting.
Thanks.
And thanks so much for just being on. I think you shared a lot of wisdom within just this hour or so. And so we hope that these conversations can just be helpful for a lot of people. And it's just so nice to talk about stuff, like diving deeper into topics that mostly are taught even on a surface level. So we really appreciate your time.
Yeah, thank you.
You're welcome. Thank you guys so much for having me.
Awesome. And if you want to check out any of her information or social media, we'll have it on the description below. And be sure to look out for what's coming next with Dr. Courtney Tracy.